Hello everybody, David Wilson here, doctor from Dr. Stem Cells, and in today's video we're actually looking at migraine. Now if we go across here and pull up our reference paper, you'll see that it's not a paper. I'm not talking about a paper today, I'm going to talk about the guidelines based on the Norwegian Health Institute's recommendations for patients. Here we have the discussion of migraine. Treatment of migraine can be done different ways, and the interesting thing here is that as we're on this this page, you can see here at the top, migraine treatment. This is all translated from Norwegian to English using Google Chrome. You could just right click and translate the page. Importantly here, it says the word seizures. Migraine in Norwegian, every time you have a migraine in English, you would say in Norwegian that you've had an attack or a seizure of migraine. So it's not saying the word seizure, it's actually the same word that's used for epileptic seizures, but here we're discussing migraine specifically. You make the most important effort yourself. You avoid things that trigger the migraine in you. If you still have seizures, then there are likely several medicines. That reduce the worst symptom, and those are seizure medicines. If you have frequent troubles with migraine, it's appropriate to take preventative medicine. And here it says in Norwegian, migraine is a normal type of chronic headache. Classical migraine first comes with an aura, which is a group of warning symptoms, which then show you that there is a migraine on its way. Self-treatment of migraine. The attacks are very painful. Many are concerned that the condition is due to serious underlying disease, but if your doctor gives you good information, then you would know that these things do go over. They're self-limiting, they tend to stop, and you tend to have a relief afterwards, and they're not life-threatening. However, they do have a detrimental effect on quality of life, and you may find then that treatment options are worth considering because they can help have better quality of life and a positive outcome. We need to identify and reduce possible predisposing or triggering factors. And they've said here stress, depression and anxiety. It is my opinion that probably one of the most important is mentioned a little bit later down. Just in the next sentence it says triggering factors can be poor sleep patterns. I have met a lot of patients who are certain that sleeping and sleep deprivation are the two main factors. Now there are also dietary factors, there are hormonal factors, there are alcohol related factors. And of course, I'm not going to forget about depression, anxiety, and stress. But I think in my mind, I would have switched these two sentences around. It doesn't really matter. Training and relaxation exercises may help. Acupuncture may help. And actually, I was asked to do this video specifically by Jeremy Pont because he wanted to know what migraine treatments are by doctors and to see if there was any kind of commonality between what we can do and what a chiropractor adjustment might do. Physical training and relaxation exercises, acupuncture and chiropractic all have those same things in common, that they're trying to get rid of the stresses in the neck, the jaw, the skull, and they might help patients have some effect. I don't know. The next thing to mention then is avoiding your triggers. If you know something is a trigger, you have to avoid it, because if you don't, it will come and bite you. And the reason we say that is many people can be triggered by things like perfume or aftershave. And if you have an aftershave or perfume, you walk past it, you just get a blast of that, and that can be enough to just bring a migraine on out of the blue. On the other hand, some people know they don't tolerate red wine or coffee or chocolate or cream. Some cheeses cause the problems. Those things are all things, if in your case you have it, you have to avoid it. If you don't know what your triggering factors are, the most important thing you can do is to write a headache diary. Every time you get a headache, you should try to write a diary entry to remind yourself what you had just in the surrounding hours, the window before. And if you had any food, any drinks, anything that might play an important role, even stress. If you're a woman, time of the month, how those things are going with hormones and your cycle, what medicines you're on, everything you've done that you think might be important. Then, over time, you will build up this diary. You'll be able to see if there's any pattern that emerges, and if there is, you want to then clutch on the triggering factors and try and reduce them as much as possible from your daily life. Now, I'm sure some of you women are currently shouting at the screen saying, well, I can't do anything about my periods, and you're 100% right. If you have hormonal reasons, you need to talk to your doctor, and in that case, you would be trying to get a medical treatment to try and reduce the variation. You'd be trying to get a medical treatment. And in that case, you'd be trying to get a medical treatment to reduce the variation that's caused by hormonal changes during the month. So in case of point, you might even go for one of the hormonal options to try and stabilize things. Finally, some things can affect migraine and trigger migraine. Lack of sleep, hunger, so if you're in a starvation period, you can get it, stress or rest after stress, strong sensory input, smells, and active or passive smoking. If you have an attack, you feel probably that you're going to need to go and lie down. Now, let's take a look at the classical traditional migraine relief medicines. First of all, regular pain relief. You want to try your paracetamol, you want to try ibuprofen, you want to try Voltarol, whatever you have, whatever you normally would take for pain, try it and see if it helps. If it helps, fantastic. If it doesn't help, okay, we move on to the next line of treatment. If you're pregnant, you're not allowed to try most of the drugs. Unfortunately, you're going to have to, we'll get to that at the end, but you're going to have to try paracetamol and the non-pharmacological interventions. Migraine medications would be the next step. And if you don't have a effect, if you don't have any kind of effect that you're satisfied with, so if you don't have an effect, step 2 would be looking at your migraine medications. And if you try the paracetamol or ibuprofen or similar, and it doesn't give you the effect you're looking for, you do want to try a triptan. Triptans are specially derived medicines with a focus on migraine treatment. They are not normal painkillers. You cannot take them too often, and it's important to follow the instructions that your doctor gives you. But in the meantime, they do seem to help an awful lot of patients who have pain in the acute phase, as long as you take the triptan early, when the headache just starts, but not during the aura phase. Current research suggests that if you take them during the aura phase, you may actually have less effect. Side effects for triptans are mild and transient, something similar to paracetamol. Some people experience these different side effects that are mentioned here. I think that, generally speaking, the risks are so small compared to the potential benefit that it absolutely is worth your while to try it and see if it helps. Step 3 then is a combination of those two types of drug. Now we get on to the more interesting field for doctors, preventative treatment. Here we have an entire list of drugs that we can look at. I'll have that a little bit later on, but right now, here we do have, in fact, an entire list of drugs we can try. Generally speaking, one starts with the least dangerous, or the ones which are least likely to cause side effects. So beta blockers are tried first, and they do help a lot of people to have less frequent or less powerful migraine. Beta blockers slow the heart rate, and they were actually designed originally as blood pressure medication. We've discovered they're maybe not great for that. They're not the worst, but they're not amazing. And that being the case, then we try them now for this, and it does seem to be a good indication for them. The dose should be increased gradually, and as the beta blocker effect hopefully comes on, you then would find out that it's worth staying on it. If, however, you've had no effect after 2 to 3 months, you probably want to cut back or find something else to do. Botox injections may help if you have chronic migraine, but they're saying that it doesn't really help if you have migraine that just comes and goes, because generally speaking, people with chronic migraine have a migraine that lasts for days and days and days. But in the acute phase, Botox injections aren't going to do much. Newest treatments available are these monoclonal antibodies, and as of the end of August last year, 3 different preparations are approved in Norway, and you can see the name of them there, and they've been shown that these can have an effect on people with migraine who have more than 4 days per month. So they're very expensive. They're actually, in Norway, they're only given on a case-by-case basis. They must be applied for and then approved, but that is something that in Norway people can try and certainly have had some benefit with. After 6 to 12 months, you want to stop the treatment, and the reason for that is to try and make sure that it's actually worth continuing. So if you've tried the monoclonal antibody, very expensive, and let's say after 6 months you stop and you're no better, you're no worse, then you can stop actually taking the medicine for a while. Now we get on to a slightly more difficult topic if you're pregnant, because in pregnancy, the rules of medicine, first do no harm, become extremely important. We first must do no harm to the baby. So that being the case, during the first trimester, second trimester, we would say non-drug measures are best, and third trimester, but we'll get to that in a moment. But if you have to, you can take paracetamol. Ibuprofen and other non-steroidal anti-inflammatories are not recommended in pregnancy in general. However, they're not as dangerous in the first 2 trimesters as they are in the third. In the third trimester, they must be avoided. Finally, preventative treatment is probably better than trying to take treatment as required. And the reason for that is because when you take a treatment at the time of headache, you're fighting, I think, personally, quite a difficult challenge, quite a difficult or maybe even a losing battle. So if you end up fighting against a treatment, I think prevention here is better than the cure for the ladies who are pregnant. If they can remove things from their lifestyle, sleep well, eat well, and this is easy to say but difficult to do in practice, of course, but those things are going to make a larger difference than trying to take something once a migraine has begun, because in that case there isn't really a lot you have left to try. Beta blockers are the first choice, they say, and I think that's fair. Now, this is a quick overview of this document. Let's come back. So that was a quick overview of that website and what they recommend as the current first, second, and third line. Now we've just had a look at the Norwegian website, which reminds us of the first, second, and third lines of treatment. We want to maybe think about regenerative medicine. I've done a video in depth now. It's quite a long video, maybe unfortunately long. I'm not sure. You can let me know what you think down below in the comments field. But that video, I'd look at neurodegenerative diseases, so Parkinson's, ALS, MS, those kinds of dementia, those types of diseases. Stem cells and regenerative medicine are now being used as part of the research push to try and find curative treatments or treatments which can improve outcomes rather than have a fall in function over time. That being the case, we want to look at these treatments and think to ourselves, well, if they can work in that case, can they work for migraine? Migraine is not traditionally a neurodegenerative disorder. It's looked at more as a paroxysmal headache. We're not actually quite sure of the underlying mechanism of migraine. It may be due to old injury, it may be due to hypoxia, so other stressors in the body, it may be due to the body having some kind of problem with the cerebrovascular system where the blood flow to the brain is changed or reduced in some way. But there is a lot of discussion, a lot of research ongoing to try and find out why migraines happen. In the meantime, that means that looking at stem cells as an option, given that we have a relative dearth of effective treatment for migraine, may well be something that should be more researched into the future. Stem cells may be able to repair some of the neurological pathways if there's damage, but if someone has migraine, we don't know if there's a genetic predisposition. Right now we don't think so, but there may be. If there are epigenetic changes, stem cells or exosomes may be able to provide some kind of input, but again, at this stage we just need to say, I think we need more research. If you have any questions or comments, please leave them down below the video and I will read those. Also, if you have any topics you want me to discuss, please leave me a comment because I want to know what you want to learn and what you're interested in hearing about. Otherwise, I think that's all for today. Have a great afternoon, have a great day. Otherwise, I think that's all. So I hope you have a great day and we will see you in the next video. Bye-bye.